I mean, I talk to parents every day that tell me, you know, my son or my daughter couldn't have afforded to go to school. I got 3 kids to educate without pops. Or they tell me, you know, my daughter had an offer from the University of Georgia, and she stayed in Louisiana at LSU because of the TOPS program. Sure, it's working. Sure, some of our kids don't make it, but at least they tried.
Yeah.
You know, at least we got them to take harder courses in high school and try college. They don't make it at LSU or Southeastern. Maybe they'll drop back and try community college. I think they just leave TOPS alone and stop trying to hurt it.
Yeah, I agree, and hopefully that'll be what will happen. Now, an even bigger hole is in Medicaid, which looks like it was underfunded by $335 million.
Jeff, Medicaid's going to eat us alive. Now, I mean, we're spending, if you count the overhead, we're spending about $9 billion a year out of a $25 billion budget on Medicaid.
Wow.
And it goes up 5 to 10% a year. Even if it just goes up 5%, that's $450 million we have to find every year. What we've got to do with Medicaid is say, look, we've got X number of dollars to spend and no more. Make it work on X number of dollars. And if the head of the Department of Health and Hospitals and the other people over there running that department can't make it work, I'll bet you we can find some people to pay their big salaries to who can. But we can't just keep letting it go up 5 and 7 and 8 and 9% a year, because we're going to look up in about 7 years, and Medicaid is going to be 60% of our budget, and we're not going to have any money for roads or education or schools or coastal restoration. I think it's a management problem as much as anything else.
Well, I agree, and I didn't realize it was growing at that rate. That is shocking.
When right now, I'm going to take out the overhead, okay? Just the pure Medicaid program is about $8.4 billion. When Bobby became governor, it was $5.9 billion. So it just, you can see the trajectory.
Yeah,
and
out of control.
We just can't afford to offer free health care to everybody in the state. We can't. Now, I wish we could. We can't. Unless everybody else wants to just pay twice as much in taxes.
And aren't there some success stories in other states that we could emulate here in Louisiana?
Texas, Oregon, Florida have done a great job of controlling the visits to emergency rooms, where people in Louisiana on Medicaid can take a $700 ambulance ride to an emergency room paid for by taxpayers to get treated for acne, or to get a pregnancy test, or to have a wart removed. I mean, it costs 5 times more to do that at an ER. If they just go to a private clinic, if we steer them to a private clinic, we'd save a lot of money. Other states are doing something about it. We're not doing a dadgum thing. Nothing. You can go, if you're on Medicaid, you can pretty much go to an emergency room as many times as you want to for whatever you want to.
Amazing. And
they're going to treat you, and they're going to send the bill to the Louisiana taxpayer. Now, you know, if human nature is such that if you give somebody something for free, not everybody, but some people are going to abuse it. And that's really the problem we have. All we've got to do is copy what they're doing over at Houston's Herman Memorial Hospital. They've got a really good program that steers people away from the emergency room to private clinics. They've saved millions of dollars. But it's not going to happen under this administration. It's just not. It's clear to me what they want to do is push this problem off to the next governor. They want to push the mid-year budget cuts off to the next governor, and the next governor is going to have a heck of a mess.